Hi, I'm recording this video as my first log for my nursing practicum. I'm in Augusta's emergency department, and I'm responding to a couple of the questions listed in the syllabus. So one of the first questions that I wanted to address was, what leadership styles have you observed, from whom, and were they effective, or how were they effective? So I talked about this in my most recent practicum, clinical group meeting, but this past week I was able to assist in a code situation. A patient came in from EMS. EMS had already started the code on her, so they had attached the Lucas device, or had set up the Lucas device, and then our team, or Augusta's ED team, started, and also Augusta ED has different breakdowns of where staff is placed from day to day. So the red team always responds to traumas, and they'll also respond to traumas within the hospital, which I thought was really interesting because Augusta is a community health setting, versus UVA has a MET team that goes around and responds to codes throughout the hospital. The emergency department is that team for Augusta. So this was coming from EMS. They arrived with the patient. I don't remember how long they had been doing CPR to the patient, but she came in with the Lucas device, and they were breathing for her, from what I remember. And so we started compressions, and but before the patient came through our doors, when we got the call, the doctor, because there's always a cardiologist and a another physician, like an ED physician, to show up to the scene or to the room for the patient. The physician came, and I was standing in the room, came up to me and asked me my name, which I thought was really unnecessary at the time. I don't think of a student nurse being particularly helpful during a code necessarily, but he came up to me and looked at my badge and said, "Oh, what is your role? What's your name?" So I said, "I'm Anna, I'm a UVA nursing student." And then there was another JMU nursing student there too, and she introduced herself. And then later during the code, once the patient had come in, he asked me by name to help out with something, which I thought was really awesome. And I just think that was a very effective leadership style, because he took the time out of his day, and out of his brain space, to remember my name and know that I was capable of helping out with little things. So, but then was also very direct, because in a code situation you have to be pretty direct. It's not a please, it's a go do this. But he said, "Anna, can you grab this lube for me?" Because he was lubing up, he was gonna intubate the patient. So I'm not sure what the tool was called, but he asked me to put the lube on. So I thought that was really awesome. And then later he called me by name again, because I was standing in the room and I was an extra pair of hands. Other people would ask things just generally to the room, but I think that we were taught during CPR and other classes that if you know a name and you can ask, if you don't know the name, just point at somebody and saying you go call 911. Not that you'd be calling 911 in this situation, but more so that instead of the doctor yelling, "You go do this," he called me by name, whereas other nurses and medical care providers in the room would say something along the lines of, "Can somebody do this for me?" So I thought that was a really effective leadership technique, and showed that he cared about the other people working to help the patient in that scenario. I think that kind of blends into the next question, which is, describe an experience event that changed your practice or is significant to you. The code was obviously very significant, and I'm considering writing my exemplar about it, although I don't think I was the most helpful, or I didn't feel like a full nurse because I wasn't utilizing the full role of a nurse during the code. But I think in other ways that I've felt like a real nurse in practice is when my nurse trusts me to go into a patient's room. We'll see on the lineup of patients that so-and-so needs an IV and needs to get checked in, is what they call it. So at this point, I know that I can go into the room, set up an EKG on the patient, if that's necessary, but a lot of our patients get EKGs just as kind of a preliminary checkbox. So getting a set of vitals, getting an EKG set up with all of their stickers and all of the wires, and then also setting up an IV, because most patients, if they're getting an EKG, they also need a line. And my nurse trusts me to go into the room, set up the EKG, get the first set of vitals and chart the first set of vitals, but then also be prepared and ready to start an IV. So I will get all my equipment out, all of the common tubes or labs that we need, and then also start looking at the patient's arm and seeing which veins I like versus, or if there's nothing good, telling her, like, I don't know if I'm confident in poking this patient. And I think that having the confidence to say that in front of a patient, hi, I'm Anna, I'm a nursing student working with Kelsey, who's your nurse. I'm just going to get started in here. We're also going to set up an IV today. Do you prefer one arm over the other? And sometimes I'll crack the joke of, do you, which one is your least preferred arm, I guess, because that's the one getting poked. But most patients are really trusting of me. I think it's kind of that white coat, not that I'm wearing a white coat, but the white coat syndrome of trusting somebody who comes in the room and acts confident and is a part of that medical care team. But I'm getting more and more confident with IVs, and when I'm able to set up a whole patient's check-in portion of their visit and get that first set of vitals, get the EKG, and then set up for an IV, and then do the IV confidently once my preceptor comes into the room, makes me feel like a nurse, like a real nurse, like I'm doing my job, and that I'm becoming more confident and capable in these skills that some of my other peers are not getting to experience as often as I am. I'm not necessarily like asking questions of the patient about where their stomach pain is located or when it started. And maybe I could start doing that with my nurse's help, but I think that a lot of her knowledge set in asking those questions is coming from just her repetition and practice of being in the ED, and I feel like I would ask probably a lot of unnecessary questions, so that's something I want to learn and grow and do more. Augusta Health doesn't use Epic also, so I'm slowly but surely learning this new charting system, and I feel like I'm really only capable of charting a couple of things at the moment. I don't really know how to chart a full assessment, unfortunately. Not that we really do a full assessment on emergency department patients, but I know that I can chart vitals. I know that I can scan medications and know how to administer them, at least within the chart, and knowing how to administer most medications to the patient anyways. And I know how to send the labs out, but just learning those like extra tidbits has been interesting on a whole different system at a new hospital location. I know that I'm supposed to share a creative side as well. I didn't write a song or poem or anything like that, but I have been thinking more about just the culture of Augusta versus UVA and how they're, in my mind, very Southern, but I think it's just the Appalachia culture is really a big part of patients and how they engage with us, and how words like honey or sweetheart can really help a patient relax because they feel like they're talking to somebody they know and talking to a neighbor, so I find myself using those phrases more and more. So I guess creativity is just coming up with nice things to say to my patient or ways to make them laugh because I consider what they're saying accented or, in an accent versus they don't consider themselves to have an accent, yet they, come in, they're like, oh, my stomach's hurting or whatever. But I think that's been maybe the creative side of nursing so far in my practicum. I hope this wasn't too long, but thank you for listening.